I really see a lot in different parenting groups, in different areas. I mean, in different regions, actually, is like, it seems like people don't really get the difference between formula and breast milk. And that's surprising and sort of counterintuitive, but actually it looks like this is a fact. And many people really don't see the difference. So what would you say to anyone who potentially considering, oh, maybe I should substitute, or maybe I should actually do formula? So what are the key maybe points that you would mention?
Yeah, well, what I would say is that probably the key difference between formula and human milk is that formula is basically dead. Any living parts of it that were there previously from the cow, because most of them are made from cow's milk, have been killed by the processing. You know, they've been pasteurized, they've been, heated, all sorts of things happen. Sometimes they're turned into powders, depending on what form families are using. So basically, there is nutrition there, of course. I mean, I personally was formula fed, so, I'm alive to show it, to talk about it, but it's what it's lacking is it lacks all of the living components that are in human milk. And these living components are, they're what help babies develop a really strong immune system. They are also important. There's growth factors in there. There are components in human milk that are unique to human milk that are needed by human babies, and so they're absolutely missing from infant formula. Now, we're of course happy to have formula. If there's some sort of emergency and you can't get human milk. Here in the United States, a lot of families are now actually sharing milk with other families. Like, for example, if someone's adopting a baby, they might give them large amounts of expressed milk that they have in their freezer. I think families are beginning to realize here in the US how important human milk is. And that's why, there's this sort of grassroots, movement to share human milk in the US. But, it's like I say, the way I think about it, it's a little bit like a blood transfusion. There is a product that's called artificial blood. And it's not made from human blood. And, again, you're glad it's there if there's some sort of emergency. But, if you needed a blood transfusion, your first choice would always be, donated blood from a human being, because it would obviously be much better. And the same thing is true, I think, when it comes to babies feeding is, human milk is, was made by nature to improve the growth and development of human babies. So they're just very, very different substances.
And I know this is not a topic of our conversation, like talking about formula, but I think this is very important, and it's like an elephant in the room. We cannot avoid it, that many actual families go for it.
Yeah.
So if we're talking about the side effects, are you aware of any potential health risks associated with bottle feeding? Because what I hear a lot from parents that, look, I have two kids, one was bottle fed, he's alive,
completely normal.
he's good, completely normal, doesn't really, differs from any other kid.
Right. Well, as I say, I was formula fed myself, and I'm alive to talk about it today. But on the other hand, I have allergies, and that is, I think probably the fact that I was formula fed has a lot to do with that. Because, you're getting these foreign proteins from cows, into babies at a time when they're very immature, and, it can trigger allergic reactions. So that's one thing. When it comes to babies, we have a lot of information about differences in health outcomes. For example, babies who are formula fed are much more likely to get ear infections, gastrointestinal infections. They're more likely to be hospitalized. The rate of sudden infant death syndrome is actually significantly higher in formula fed babies compared to babies who are nursing. But that's only part of the story. A lot of times I meet families, they're like, oh, well, we know that, human milk and nursing is good for babies. But I also like to talk about the importance of it to the nursing parents, because, for example, we've learned in recent years that those who do not breastfeed have a much higher incidence of breast cancer and ovarian cancer. And illnesses run in your family. You know, that's really important to know. And there was one study, for example, that found that if all women had a lifetime total of uh, of all breastfeeding, you know, for adding all the children together of at least 29 months, that this would cut the number of breast cancer cases by 1/3 to 1/2.
Oh my
So, I
God.
mean, that's pretty incredible. And breast cancer, you know, is a big concern in many families. But also, for example, when you produce milk after delivery, the longer you do it, the more it helps your body, your metabolism to reset in a healthy way. So one of the things it does is it makes your insulin sensitivity greater. So for example, those women who nurse after giving birth are much less likely to develop type 2 diabetes, especially those who have had gestational diabetes, but really anyone. And it's not just during the time they're nursing. For the next 15 years, you know, nursing can decrease their incidence of type 2 diabetes by as much as 15%. So it's actually quite significant. And in fact, all of the indicators of metabolic syndrome, which has become sort of a new thing in recent years, where it looks at things like abdominal fat, blood pressure, cholesterol, type 2 diabetes, you know, all of the indicators of metabolic syndrome, your risks of those are lower, you know, if you nurse after delivery. So I always like to talk about both why breastfeeding is good for babies and why it's good for nursing parents, because I think a lot of parents don't realize that they really have a lot to gain by nursing their babies personally.
And do you see, do we have, because lots of parents asking if there is a correlation, a connection between the duration of breastfeeding and the benefits for the parent, for the mother, for example?
Oh, there is definitely.
1 month of breastfeeding or 2 years of breastfeeding?
Yeah, well, the longer and the more exclusively you nurse your baby, the greater these health effects are. So absolutely, you know, I like to say any amount of breastfeeding is better than none. Some breastfeeding is nearly always better than no breastfeeding. So even if, you know, you're combination feeding, then it's still going to be better than completely weaning the baby and not nursing at all.